In today's presentation, we will be discussing lateral and horizontal violence and bullying in nursing. This is a prevalent problem within the nursing profession. This presentation will cover what lateral and horizontal violence is and how it is a leadership issue. It also covers the background history of lateral and horizontal violence and bullying in nursing, and it will explain how each issue is being addressed at each team member organization and the solutions generated from the text. This slide discusses what lateral and horizontal in nursing and bullying is and what it involves. Lateral violence, workplace violence, bullying, and incivility are interchangeable terms that are used to describe inappropriate behaviors that transpire between coworkers within the nursing practice. According to the American Nurses Association, these behaviors include but are not limited to verbal, physical, sexual, and psychological assaults. All nurses are subject to experiencing lateral violence at some point in their careers, even nursing students completing clinicals. The severity of the harm lateral violence causes is determined by the type of behavior and duration. Each individual's perception and experience of lateral violence within the nursing profession is unique. This chart provided by the Crisis Prevention Institute displays the range of expressions of lateral violence. Bullying in nursing can be overt or covert, meaning it can be obvious or concealed. Examples include facial expressions during conversations, gossiping, and exclusion of coworkers from discussions. As stated in Huston 2024, lateral violence in the nursing profession may involve favoritism, verbal abuse, and intentional sabotage. Nurses and healthcare professionals are at 6 times the risk of experiencing lateral violence than any other career field. It can cause decreased job satisfaction in nurses as well as an increase in patient safety concerns. Lateral violence not only affects the nurses involved but also other team members in the healthcare facility. These statistics describe the detrimental effects of lateral violence in the nursing profession. Lateral and horizontal violence can affect nursing leadership by leaving a lingering impression on nurses. The ANA reported the following: the repeated psychological distress caused by workplace violence has been shown to induce sleep disorders, fatigue, and post-traumatic stress disorder, leading to nurse and healthcare worker burnout. Nurses not only have to endure the mental damage that lateral violence causes, but also the physical damage as well. Furthermore, it can also contribute to financial repercussions. Workplace violence decreases productivity and patient care, which can make nurse retention challenging for nurse leaders. Nurses also may experience physical manifestations because of lateral violence, such as irritability and depression, which can increase the chances of them making medication errors and increases the risk of patient safety. The background history of lateral and horizontal violence and bullying in nursing reinforces the statement that nurses eat their young. According to Bentley 2024, the first recorded incidence of lateral violence in the nursing practice was published in the New York Times in the 1900s. Charge nurses were expressed as strict, harsh dictators who belittled other nurses. This fact highlights how bullying within the nursing field has been a concept for a long period of time. The mean nurse stereotype has negatively influenced the field of nursing. Lateral violence has become a widely accepted idea condoned in the healthcare system. And as this slide states, this is caused by the patriarchal historical background of nursing, with internalized sexism due to oppression. Here are examples of triggers that may contribute to lateral and horizontal violence within the nursing profession. Nurses are already subject to encountering lateral violence from patients and their family members, leading to increased numbers of burnout. This perpetuates the risk of nurse-to-nurse bullying in the healthcare system. The incidence of lateral violence in nursing also rises due to women constituting almost 90% of the field. It revisits the historical patriarchy of the nursing profession, emphasizing the systemic scarring that it has left on today's nursing practice. As expressed in Diamond 2024, lateral violence in nursing usually contains insults that targets one's appearance and individuality due to patriarchy. And this has also contributed to the power imbalances between nursing staff. We will now move into the literature review portion of this presentation. This slide suggests that some nurses are more at risk of experiencing lateral violence than other nurses. One in 2025's research study illustrates how workplace bullying is also governed by cultural differences and power hierarchies in the nursing field. It identifies how power imbalances in nursing and organizational culture can lead to bullying. The article suggests that nurses may be motivated to participate in lateral violence towards other nurses to receive prestige from colleagues and possibly financial gain. These power dynamics increase the likelihood of lateral violence within the healthcare system. It affirms the statement that lateral violence and bullying are encouraged indirectly in the nursing profession. Lateral violence has contributed to the already expanding nursing shortage. Nursing students can determine to stop pursuing a career after witnessing lateral violence in the clinical setting. As stated in Bentley 2024, as nursing students rotate through units of a facility, if bullying behavior is experienced, new graduate nurses may avoid these units following graduation. Bullying impacts nursing recruitment greatly. As stated on this slide, 1/3 of new graduate nurses leave the nursing profession within 3 years of practice due to lateral violence. If not addressed appropriately, lateral violence will prevent the advancement of the nursing profession entirely. Nursing violence can decrease engagement in patient care, which can cause nurses to make more mistakes. Lateral violence is a widespread issue affecting all nurses globally. As shown, one study revealed that females represent a large portion of both the offender at 53% and the victim at 80.2% of lateral violence. The research demonstrates that those who bully and are bullied are majority female nurses. This reiterates that lateral violence is a direct result of oppressive gender norms in the nursing community. Bullying in nursing is also more common in specialties that require more strenuous work and intense mental strain. As shown, those include specialties such as emergency room nursing. It causes nurses to be more likely to say or do things that would be considered unprofessional in the workplace, increasing the risk of nurse-to-nurse lateral violence occurring. The staff nurse's approach to resolving lateral violence is to learn healthy communication skills and conflict resolution skills. In King's 2021 study, staff nurses suggested that setting limits, removing disruptive conversations to a different area, or completely rearranging their work schedule to avoid the other team member were possible solutions to prevent lateral violence. A unified proposal was made that staff nurses should present their recommendations to nursing leadership during staff meetings, which can help avoid one nurse being ignored when suggesting new ideas. This will facilitate open communication among the entire healthcare team and bring forth more propositions to resolve lateral violence. Staff nurses imply that using effective communication and notifying management as a team is a functional technique to challenge lateral violence. Nurse leadership holds a vital role in the prevention of lateral violence in the workplace. It is essential that nurses feel comfortable informing their nurse managers of any incidents of bullying on their unit. The role of nurse leaders is crucial in encouraging staff members to report inappropriate behavior. Additionally, using constructive and positive leadership styles will transform the unit's culture in a way that lateral violence is not tolerated. According to Burkhart and Nathaniel, the most efficient way to eradicate lateral violence within the workplace is to be an authentic leader who encourages a productive work environment. And as shown on this slide, that looks like the nurse leader setting the example to encourage staff nurses to share their opinions and feelings during meetings, as well as tracing the patterns of lateral violence before it becomes an issue. Zero tolerance for lateral violence is the general resolution towards lateral violence for hospital administrators. It involves treating lateral violence and bullying in the workplace as a serious offense with precise consequences that employees should be aware of upon hire. This policy will significantly decrease the percentage of lateral violence by displaying that healthcare institutions frown upon any form of bullying in the workplace. As stated in Hofer and Williams 2022, adding modules concerning lateral violence and bullying to the curriculum, including role-playing scenarios, can increase the resilience of the new nurse and prepare the next generation of nurses to not view lateral violence as a part of the accepted culture. This statement denotes the need for staff education on lateral violence to aid in removing it completely from the workplace. Zero tolerance for lateral violence is the general resolution towards lateral violence for hospital administrators. It involves treating lateral violence and bullying in the workplace as a serious offense with precise consequences that employees should be aware of upon hire. This policy will significantly decrease the percentage of lateral violence by displaying that healthcare institutions frown upon any form of bullying in the workplace. As stated in Hover and Williams 2022, adding modules concerning lateral violence and bullying to the curriculum, including role-playing scenarios, can increase the resilience of the new nurse and prepare the next generation of nurses to not view lateral violence as a part of the accepted culture. This statement denotes the need for staff education on lateral violence to aid in removing it completely from the workplace. Required continuing education courses and conflict resolution training will tremendously influence the occurrence of lateral violence in the workplace. The ANA determined that staff education must include protocols on reporting lateral violence and how to respond, as well as post-incident support of the victim. These protocols will encourage more nurses to report incidents of lateral violence, exhibiting the positive outcome of education. It also reflects Provision 4.2 of the ANA Code of Ethics for Nurses, which highlights how lateral violence can negatively affect a nurse's authority in their practice. Through education, nurses will accurately exercise their nursing authority by challenging and appropriately acknowledging any form of lateral violence in the workplace. Also, a confidential reporting process is a vital aspect of a caring and healthy work setting, which will increase trust in nurses with their nurse managers. In the ANA Code of Ethics for Nurses, Provision 5.2 states that nurses should not tolerate discrimination in their practice. Nurses create a moral milieu in which moral perspectives may safely be expressed, values are clarified, issues that impact health equity are identified, and difficult and intentional conversations occur. This explains how it is the responsibility of all nursing professionals to help end lateral violence and incivility by creating policies that condemn those behaviors. Moreover, it is paramount that education on the topic is publicized to all staff within the healthcare institution. This will prevent any future circumstance of lateral violence among coworkers. And as stated on this slide, in order to eliminate lateral violence, it must be an equal dedication among all organizations to generate positive results.